Welcome to Be Well, Equestrian, the podcast where we talk about all things wellness and community and how that plays into your life as an equestrian. My name is Rachel Windsor.
Dr. Sarah Young.
And today we have a fun topic, but before we get into that, we're going to chit-chat about something.
Oh God, what are we going to chit-chat about?
I didn't plan it. I didn't come up with a topic. I got this far. Just put a dash.
It just says chit-chat. What are you and Valiente working on right now?
Okay, that's a good question. Okay, so
tell us about Valiente first.
Yes, Valiente is the colt that my mom and I bought over the summer. He's now he turned 2 in October, and Dr. Sarah has helped me with the behavior training with him and kind of building my confidence with him, because when we got him, he was a little.
He's a baby.
He was a baby, and he prefers to go vertical, and that was very intimidating for me. So what did we work on last? Well, the next thing that's coming up is my barn is doing the inflatable.
Ooh, right. I'm so excited about that.
So that was supposed to be this weekend, but it kept getting rescheduled because of the weather.
Right.
It was so cold that the inflatables that they got wouldn't even stay inflated. I'm not complaining because it was so freaking cold. I didn't want to go out. So when the barn manager said she canceled, I'm like, oh.
You're like, oh no.
No, I said, oh, great, because it's so cold. I was going to do it, but I didn't want to. So I think it's going to be this weekend now.
Okay, well, that'll be good.
So we're mostly just working on, the thing I was working on last was trying to get him to side pass over. So I put a pole down and I was trying to get him to move sideways over pressure. But he did it a decent number of times, like maybe 25% of the time. But he also would go forward or backward.
Mm-hmm.
And I was like, I want you out for this because I know that it's really to do with my body language. So I gave us a break and I was like, let's just walk around, shake it off, try again. And I wanted to get him trotting. And so I was jogging and dragging and he's not moving. But then I gave him a longer rope and started jogging and he jogged right after me. I'm like, oh, he does not move to pressure. He moves into the absence of pressure.
Yes, into the open space.
Right.
Yep.
So I was like, I have to figure out how to translate that into this side pass.
Yeah.
Where instead of saying, I'm pushing through you, that just kind of causes him to push back against me or to move backwards or forwards out of the way. So how do I create that open space that makes him move into it sideways? Right.
Yeah.
So we didn't fully figure it out, but he did kind of, like any time that I got him to move even a little bit sideways as opposed to directly back or forward or just freeze and stare at me was progress. So yeah, that was what we were working on. It was very tricky, but I was excited because I felt like I started to understand his training language better.
Yeah.
And it's something I've never had a horse do before. Usually it's because he's so young too, so he hasn't really been trained to move away from pressure in the same way. So I'm like, okay, this is fun because what I want to work on with him with the liberty and everything, being able to play with that open space is going to give us more language that we can work with.
Yeah.
Which is going to be cool.
That's fun.
Yeah.
He's a good boy. He's so smart and he figures things out so nicely. And I'm really excited for you guys to work together because he's a blank slate and because he is showing you very honest equine behavior. So like what I tell people with foals is foals move into pressure. If you put a butt rope on a foal and you try and drag them forward, they're just going to sit back on that rope. So you have to like give them little bumps along. Like if you put constant pressure on a horse, especially if they haven't been taught to accept constant pressure, which we do sometimes with them. We tell them like, I'm going to press on you and you just have to stand there. But, if they haven't been taught to accept constant pressure, then they will just move into that pressure because that's the best way they know to try and get rid of it. So it's really cool that you are working with a green horse who is showing you really honest behavior and really honest reactions to that, because as you guys grow together, you'll be able to take this honest behavior from him and retrain horses who have maybe learned to not show honest behavior, and you'll know what to watch for that like switch from maybe a little bit of learned helplessness or maybe a little bit of like shut down to having normal horse reactions because you'll be used to seeing it from him.
Yeah, that is a good point too. And it's so fun to watch from the beginning. Like trying to figure out his personality. And nothing bad's ever happened to him in his whole life.
Yeah.
So
bubbles and rainbows all the day.
Exactly. So he expects nothing bad to ever happen.
Yeah.
And that's super fun. Like whenever he's nervous, he does the cutest thing where he just like boops me with his nose. Be like, are we good? Okay.
You're good. You're so smart.
so cute. It kills me every time. And he's like, okay, be brave. I'm like, you're so brave.
Oh, such a good baby.
I know. And to watch him go from being so chaotic
Yeah.
to being like, honest is the best word for it too.
Yeah.
Just like genuine, honest.
Yeah.
And he tries so hard.
Yeah.
And he tries so hard that, like, again, with the pressure, so that was the other thing, is the second I would turn to try and get my pressure, like my body facing his side, just to get into position, if I hit the wrong spot, then he's going backwards or forwards, right?
Yep.
And so I'm like, you're trying so hard,
Yeah.
and I appreciate it, but now I have to really get myself right.
Yeah, working with an honest green horse makes you such a better horseman, because they don't, if you have a schoolmaster, a push button horse, they ignore all the dumb things that you do because you don't realize that you do them.
Right.
You know what I mean? They're waiting for you to give them this button that tells them this is what they're supposed to do. But when you're working with a young horse or a green horse or even trying to teach something new to a horse that's still sensitive and hasn't learned to kind of ignore all that superfluous movement, you realize how much your body language affects their body movement and how it affects kind of how they perceive things and what they're taking in and how they're going to respond.
Right. And with this cold, I've also realized that I'm not in great control of my body.
Yeah.
I'm just like, I don't have the patience for this. I'm so cold.
Yeah.
So I tried like lunging him, and usually we don't have a problem at all. But I realized very quickly, I'm like, I'm not doing this right.
Right.
And I don't want
to hunched up trying to stay warm. And he's like, I don't know what you're telling me.
Right. And so he's like backing up, and I'm like, I'm just not even gonna mess with this right now because I'm the problem, and he knows what he's doing. And I don't want to mess with it. Okay. So we have an interesting topic to talk about today.
Yeah, let's do it.
EPM. Can you tell me what it stands for? Equine something.
Equine Protozoal Myeloencephalitis.
Very fancy.
Yep. So actually, I think it's myeloencephalitis. So it is a protozoal infection of the central nervous system.
Very fancy.
Very fancy. EPM is the reason we call it EPM is because it's way easier to say than that all of the time, obviously. So at its most basic, it's that protozoal infection of the central nervous system. And the hard thing about EPM is that the central nervous system goes from the brain all the way down to the bottom of the body, and it can affect anywhere in between.
Fun.
Fun.
So why we bring this up is this part of the country has a decent amount of EPM cases. I have 2 horses that I've worked with personally who have been affected. The first one was one my mom and I were working with in a training capacity, and then the second one is George.
Right.
So I wanted to kind of like, I'll explain the experiences that I've had with it, and then I want to hear from you first, any experience you've had with it, same like client horses or any of your horses, and then we'll kind of go through and learn a little bit more about it specifically. So, like I said, we had a training horse who started exhibiting really abnormal behavior. He's an Andalusian. He usually moves beautifully, and he started just not, he wasn't doing his turns well. His back legs were dragging, and I noticed it. I was lunging him one day, and usually with a lunge, a walk, trot, and a canter, you just ask for it and he does it, and he would not pick up the canter, and his lip was hanging. And we were like, what is going on? Why are you doing this? This is so silly. Like, because we hadn't put it together yet. And I was like, he's just, everyone's like, he's testing you, push him, get him to canter. And I'm like, nothing's working, right? And this is not normal. So we walked him back to the field. I can't remember if it was that same day or another day. And it had just rained. We're walking on the grass, and he does that thing where he's really bad about sometimes grabbing down for grass. So he grabs down for the grass really fast. I catch him, and then he slips and falls.
Ooh,
and I'm like,
yeah.
Whoa, it must be because the rain and the
Right,
slippery
the grass is
and
slippery
we're on
and
a little
short.
bit of a right.
Yeah.
And then we were talking to Lisa Luongo, another friend of ours, and kind of adding them all together, and we were like, oh, hold on. So they did a neuro test on him and a blood test, and he came back positive for EPM. And so then he had to take a break, and then we got our resale horse, George, and it's hard to know with George when he was like infected, is that the word?
Yeah, infected works.
Okay, so it's hard to know where he picked it up and when he picked it up, because we got him in May, and then by August had a diagnosis. So he had already been, he was very sensitive to the saddle, very
Mm-hmm.
sensitive to things like that. And then one day I had a trainer out because I wanted to see him move and see someone else push him a little harder than I was comfortable pushing him, because when you've been working for a horse with a horse for a while and you started at that lower, like, we're just doing groundwork and we're
Right.
just bonding, and he's got all of these issues, and so we're taking it slow, so I didn't want to push him too hard, but so I wanted to bring someone fresh in and say, do whatever you
Do
think
whatever
he's
you think.
capable
Yeah.
of, right? So she got him walking and trotting, and his trot was like, looked so nice and big, and I was so excited, and I was videotaping him, and she tried to get the canter twice and he tripped. Again, we didn't think anything of it
It's
because,
a standardbred. They don't really canter. Maybe
right,
he's just weak. Sure.
all
Yeah.
the
All
things.
these excuses. Yeah.
Exactly. And even for the kind of funkiness in his trot, is like, he's a standard bred.
Right.
He doesn't have a lot of muscle right now.
Right.
He's not used to carrying a rider. So I sent you and Lisa Luongo the video, and I was like, look, he's doing amazing. He's a big guy. And both of you responded, I think we need to do a neuro test. And I was
Yeah.
like, oh no. So we did.
Yep.
Which, can you explain briefly what that is?
Sure. So the the effect that the bug, I'll call it the bug until we get more into detail. So the effect that the bug has on the central nervous system is to affect the way that the nervous system connects with and kind of corresponds with the rest of the body. So sometimes they look lame in that it's kind of lopsided, or they just don't move, like it seems like one leg is wrong and the others are fine, but really what it's called is ataxia. So ataxia is where the limbs don't move the way that they're supposed to move. So a lot of times with EPM, what you'll notice is that they will trip because they have a hard time picking up their front feet. So they go to move and then they just kind of trip on their face, or they can't pick up the one lead or another because one half of their body is affected a little bit more than the other. So we call it ataxia, and it's different than lameness, although sometimes it looks like lameness. So because what they teach you in vet school is that EPM does whatever it wants, because it can affect everywhere from the brain all the way through the rest of the body, and not necessarily the right side or the left side. It literally, I mean, it does things all the way from making them have a droopy lip, or it could be as bad as their whole side of their face is a little bit droopy, or their tongue doesn't work quite the right way, or it could just be that their gait is fine, so they don't have that ataxia when they move, but they're losing muscle. Or they have increased skin sensitivity. I have had horses that go from really loving to be groomed to not being able to tolerate anything touching their skin. And you go through all these, well, do you have allergies, or do you not like this brush, or are you just being bratty or whatever? And then a lot of times that will progress to something else that then makes you think, maybe you're not just being bratty, and then you do the testing and the neuro test and all that kind of stuff. So what we're doing when we're trying to do like the neuro test that we did with George is put him through a series of movements that we know what they're supposed to look like. So we're going to walk him straight up and back and make sure that his feet are going in the right track and they're tracking normally and they're stepping in the right places. And then we're going to pull on his tail a little bit going away left and right, because part of what happens is that they get weak on their hind end. So they'll be unable to keep themselves in a good straight line. They'll really kind of sway as you pull on their tail. Or you pick their head up and ask them to walk forward, because if they can't see their feet, they can't feel where they're putting their feet down, because the connection has been lost between their brain and their feet. So there's this kind of prescribed method of doing a lameness a neuro exam that shows you all sorts of things, where sometimes it's normal, sometimes it's not. Sometimes it's normal to the right, sometimes it's worse to the left and to the right. So it's this prescribed number of movements and prescribed kind of thing that we do so that we can localize and confirm that it is ataxia instead of lameness.
Okay. So we did a neuro exam on George. We've got video of that too, where it shows him, dragging his feet, pulling his tail, and him not being able to resist it at all. And we were like, oh, okay. So then we took a blood test. It came back, I don't know if very positive is a way to describe it.
So testing for EPM is hard, because the only way to definitively, for sure, diagnose EPM is postmortem. So you have to take CNS tissue after the horse has died and actually find the protozoa and the eggs and the sarcocysts in the actual CNS, which obviously you are hopefully you're not doing, because that means your horse is dead. So diagnosis becomes really difficult because what we did, for example, is test the blood. So we did a serum test and we sent it out, and what you get back is a number of antibodies that tells you exposure. So exposure is hard because when you're in an area like we are, where you have possums running around. So possums are the definitive host, and the way that horses get EPM is from eating the feces, so the poop, of a possum that is infected with this bug.
Right.
The bug is a protozoa called Sarcocystis neurona.
Long name, very fancy.
Yeah, so we're going to call it the bug.
Bug.
There is another bug that is less commonly found, but primarily what you're going to see in this area is that Sarcocystis neurona. So the opossum is infected with the bug, and then in their feces sheds the eggs, for lack of a better term, but the sarcocysts of this protozoa. The horse then ingests something that has these kind of bug eggs. Again, we're simplifying a lot. There are much better terms, there are real scientific terms, but for simplicity's sake.
I am not a real scientific person.
Right, so we'll say the terms and then kind of revert back to the simple ones. So the opossum eats the egg of this bug, and...
So just to be clear, so
Sure.
the poop and the eggs and stuff, are we saying maybe they're on grass that the horse is eating?
Right, so
Okay.
it could be in your water trough because the possum's climbed up and has poop on its feet and is getting water from your water trough, and now your water trough is infected.
Okay.
Or it could be grass where the possum has walked or pooped. It could be your grain room if your grain is not really tightly closed and you have a possum in your grain room. It could be grain that you swept out of the barn and just left there. So anywhere where a possum could potentially infect your horse.
Okay.
Now, not all opossums are carriers, and not all grass where opossums are infected, right? So the only way for a horse to get EPM is to pick up one of these sarcocysts from something, to eat it, to ingest it. They cannot then pass it horse to horse, so it is not what we call a transmissible or contagious disease. It is like vector-borne only. They can only get it from the environment. Okay, so that's a little bit nicer, that like if your horse has EPM, you don't have to worry about all the other horses in your barn. It's not like
you don't have to quarantine them.
Exactly. And your horse can also not deposit anything in the environment that another horse can pick up. It's what we call a dead end host. So it is the last place that protozoa is going to be.
Okay.
So they cannot pass it on. The only way for your horse to get EPM is to pick it up from the environment.
Okay.
I forgot what we were talking about. Where did we get to?
I don't even remember either.
Okay, so let's see. We were talking about testing.
Oh, yeah. Okay.
I got sidetracked. So the hard thing is that when you're in an area where possums are all over the place, then I think the statistic is something like 70% of horses will show some seropositivity, meaning that they have been exposed to EPM and their body has produced antibodies. So as a very basic immuno lesson, when your immune system is exposed to something foreign, it says, this is weird, you're not supposed to be here, and it makes antibodies. Antibodies attach to something and say, hey, tell the immune system this is what you're supposed to be fighting. Okay. So antibodies are produced in relation to and in response to something foreign in the body, as a general across the board. So what we're doing when we do a blood test is testing for a level of antibodies. Now, antibodies don't mean that you have disease. It just means that at some point you were exposed to it. Right? So the hard thing is that you can test a horse that's not showing any neuroscience and get back a positive EPM test. Or you can test a horse that is obviously has neurological deficits. So is dragging, or is hanging lips, or is tripping, or is muscle wasted. You can test them and they might have a really low antibody titer. So it's hard to diagnose EPM because the only way to say, yes, absolutely, this disease that you're seeing, this ataxia, is caused by EPM, is on postmortem,
Right.
right? So by taking CNS tissue from a dead horse. So instead what we do is we take the antibody levels in the blood, which is the easy way to do it, and the antibody levels in the central nervous system, so in the cerebrospinal fluid, and the best diagnosis is by comparing the two.
Okay.
So some people say, I don't want to do the CSF thing. I don't want you sticking a needle in my horse's spine. It's scary. It's expensive. It's not something that all vets can do. A lot of people don't want to do it in the field, meaning they'd have to maybe ship the horse into a hospital. So a lot of times what we end up doing is just the serum test.
Right, which is what we did with George.
Which is what we did with George because we were kind of on a budget since he was a resale project, and we were pretty sure it's what it was because of his neuro exam. So it really was more of a giving us a little bit of kind of support for that diagnosis. So a lot of these diagnoses of EPM are made by neuro exam and some kind of serological testing, so testing for antibodies for exposure, and then saying, well, it can't be anything else. So kind of a diagnosis of exclusion in that way. So a lot of vets will tell you, like, I don't do blood tests for EPM. They don't test for EPM because it's not definitive. It's not telling you, yes, this horse has EPM. It's just telling you that at some point this horse saw EPM.
Right.
So a lot of vets don't want to do that, which is perfectly reasonable. They'll tell you, listen, I'll do a CSF tap, right? I'll do the CSF, the CNS fluid. I'll do that. But if you don't want to pay for it, or if you can't, or if your horse isn't a good candidate for that, then a lot of times what we'll do is just treat based on your neuro exam. And you may draw blood for other neuro disease testing. You might test for Lyme. You might do other testing that's a little bit more definitive. It's kind of vet preference, owner preference, horse availability, and financial decision, that sort of thing. So
you said CNF is the...
So CSF, cerebrospinal fluid.
So for that one, is that one more accurate? Or...
So yeah, it is more accurate. If you want a better diagnosis, then you'll go directly into the area where the EPM is.
Okay.
Right? Which is, of course, the central nervous system. So taking fluid from the central nervous system means that you have a better chance of getting an antibody titer that will show you that you've got active disease versus just peripheral blood, which says EPM touched you at some point.
Right.
So it's a little bit, again, not definitive, but it's a little bit more indicative of can be an active exposure.
Right.
The best way to do it is to do paired titers, which is where you take blood and CSF fluid and compare the ratio there.
What does that tell you?
So if you have a much higher ratio, so higher in the CNS fluid, so the cerebrospinal fluid, than you do in the circulating blood, it tells you you're more likely to have active infection.
Okay. So with George, we did just the serum.
Correct. Yep, just the blood test.
And then even before we got that test back, we started treatment. Right. And the treatment for him was, what was the vitamin A?
So we did vitamin E.
So
vitamin E is antioxidant, and it is just really great for muscle and CNS health in general. It helps to support just the health of the central nervous system. So any way that you have any kind of damage, if you have any kind of neuro disease, so if you have Lyme, if you have EPM, if you're looking at something a little more serious than that, if you've had some kind of damage or anything like that, vitamin E is really great for. And we also, I think, started him on folic acid, didn't we? Right? So old research and old kind of requirements and suggestions said that the drugs that we use to treat EPM interrupted folic acid use and kind of the use of it in the body, so that it would become, your horse would become deficient when they were on this treatment for EPM. There's been a little bit of a change there. Folic acid isn't going to hurt. It's a B vitamin, so if they get too much of it, they just kind of pee it out. So it's a good thing to add. It's a really nice complementary treatment if you have it, if your horse will eat a powder, if you have it in your finances to put it in. So that's usually what I end up putting my clients on, is a vitamin E and folic supplement, just daily. It's not going to hurt them. It's It's going to be good for them. The vitamin E is really supportive of the central nervous system, especially as it heals and tries to reinnervate things that maybe have been separated because of the EPM. And then a lot of times we'll do some kind of anti-inflammatory. So we did a little bit of Banamine, I think, for George, right?
I can't remember.
Did we? So a lot of times we do, because as you have the die-off of these bugs in the central nervous system.
I think you might have given him some while you were there.
I think I did.
Yeah.
So a lot of times we'll do a couple days of it. I feel like maybe we left a tube of Bute or Banamine.
This is sounding
something.
familiar.
It sounds vaguely familiar, right? I should have looked up his records before we actually started talking. But the kind of mainstay, the hallmarks of EPM treatment are anti-inflammatories. So we're going to use Bute, Banamine, or DMSO are the most common ones. You don't want to use steroids if you can help it, because steroids will completely squash the immune system.
Right.
So it will put them at a bit of a disadvantage. So we don't like to use steroids, no dexamethasone, nothing like that. But we do want those selective COX inhibiting NSAIDs. So Bute, Banamine, and DMSO.
Okay.
And then we probably are going to supplement our vitamins and minerals. So we're going to do our vitamin E, folic acid. We like those.
Yep.
You can also put selenium in there just because it's a nice partner to vitamin E. So that's a nice kind of adjunctive therapy. And then the mainstay of your treatment is your diclazaril or ponazaril. So those azil drugs.
Which we did ponazaril.
Ponazaril, yep. So they're hard. Ponazaril, there are two kind of FDA approved drugs that you'll get on the market. And I always mix up which they are. So ponazaril is Marquis. Marquis is a paste. It's very expensive. It is the...
I got the cheap one.
You got the cheap one, right? So arguably it is the best option. It is FDA approved. It is the one that is most likely to treat what you are trying to treat with the most efficacy.
Okay.
It is very expensive.
I did not do that.
Not that one, yeah. Your kind of second option is diclazaril, and the brand name for that is Protozoal pellets.
That might be what I got.
That's what we did the first round of Protozoal pellets.
Okay.
Yep. So there are some other options. They aren't as effective, and we tend to not recommend them. If your only option is to treat with something else, then your vet may really recommend other things. But something that is ponazaril, diclazaril is going to be your best bet for getting a good treatment. So those kind of three things: your vitamins and minerals, and your azil treatment for EPM directly, and then the anti-inflammatories as well.
So we did that for a solid 2 months.
Mm-hmm.
And I don't think we ever followed up with a full neuro exam, did we?
Well, we saw improvement. Him. Almost.
We gave him that. There was like a week where he was extra sensitive.
Yep, and that when you have a die-off, you'll have like a relapse a little bit, and that's really common. You'll hear people talk about like the die-off. As the drugs are getting into the central nervous system and kind of affecting the life cycle and what's happening in the central nervous system, there's an increase in inflammation.
Okay.
So with that increase in inflammation, you see sometimes worse neuroscience. Your horse that like maybe just drug his toes a little bit starts to maybe trip a little bit, and it's really scary for owners. So often vets will have a call that says like, I just started the meds, but he fell down when I tried to take him out of the barn today. And we have to say, yeah, that happens sometimes. You definitely don't want to do anything with him. I told you when we looked at George, like, you are done with him. We are not walking him. We are not
like
asking him like a whole month of nothing, because it's not a matter of if, it's a matter of when he falls down. If you ride him, he's probably going to fall down with you on top of him. If you ask him to do things, he's probably going to fall down. So the minimum kind of length of treatment is usually right at 28 days. That's how the Protozoal and Marquis are labeled, for a minimum of 28-day treatment. More often than that, we're doing somewhere 45, 60, 90 days. And you may start with something like the FDA-approved ponazaril, diclazaril, and then switch over to something like a compounded drug, or something that maybe isn't quite as effective, but is going to give you still some continued treatment. Yeah. So there are a lot of compounded options that some of them are great and some of them are not so great. And, it's a financially available option. Your best bet is obviously to use something that's FDA approved and that you can measure exactly what they're getting, and you know that's your best bet. But you know, a lot of times we're treating these horses for 60 days, 90 days. Really bad cases you might treat for 6 months.
Wow.
And it gets very expensive very quickly.
Yeah.
And it can be very scary because they, you know, if they're bad already and then they experience that die off and they get worse, it can be very, very scary.
Yeah.
The good thing is that if you catch EPM early and you treat it early, something like, I think they say 85% of horses will improve at least 1 grade in their neuro test in the first 30 days.
Okay.
Which is great.
Yeah.
Most horses will have some kind of lasting deficit, but often it's not something that like an owner, you know, people would notice. So they may have a difficult time then maintaining their top line, or they may have a difficult time picking up one lead. They may have a little bit of lasting weakness, something like that. But I think they say something like 25% of horses you'll never see anything again. They are cured, they're fine, everything goes completely back to normal. So.
Right. So does the amount of time that a horse has it untreated affect that?
I'm sure there are people who are much smarter than me that could give you statistics about this. Anecdotally, I say yes.
Okay.
So I have a horse that I rescued from a pretty crappy situation in 2020. He came to me as a late teens, 250 pounds underweight and a bunch of cracked teeth, and he had like nails in his hind feet but no shoes left. I mean, he was in really rough shape, and we brought him home, and I noticed pretty quickly that he had some pretty serious neurological deficits, and to the point that his hind legs, instead of being straight, he had moved to he walked with his feet right in front of each other because he didn't have sensation to his hind feet anymore.
Wow.
And it was chronic enough that he'd been walking like that long enough to affect the bony column of his hind legs. So now instead of having straight legs, he has bowed legs because he'd been walking like this for so long. So obviously we know really, really chronic neurological deficits. So I brought him home. I had a very good friend go over him for me just to kind of confirm what I was seeing. And we found that he had deficits that were so severe that you could take a pen or a needle and actually stick him from the withers back, and he did not respond to it. So he had almost completely lost track of like where the rest of his body was.
Poor
so
bud.
Yeah, he was in really rough shape. So I actually ended up doing like 4 months of Protozoal for him. So we went through bucket and bucket and bucket and bucket of this stuff. He started with a really high titer. I, again, only did the serum titer because I knew that it was EPM.
Yeah.
I kind of knew what it was. I was going to treat either way, but because I'm a numbers person, I wanted to know. So we did the serum titer. I treated for 30 days. I did another serum titer. I treated. So there was a little bit of a change in the titer, but I don't know that it was indicative. It definitely was not correlative to how his signs improved. So the nice thing is he got pretty much back to normal in terms of his neuro exam, but now anytime he gets really stressed out, he starts to show deficits again.
Really?
So there is obviously some kind of permanent damage in his nervous system that, as long as he's like living the good life, he feels good about. But he is the babysitter for my weanling colts, and when I wean him from his babies, he starts to show neurological deficits again. Aww. He starts to drag his hind feet, and so like once a year when I wean him from the babies, I do another course of treatment for him.
Of the pellets?
Yes.
Okay.
Yep. So, if you have a horse that you know really well, and then all of a sudden they start to show these signs, and you can jump on it really fast and get like a presumptive diagnosis and get him on treatment and do the rehab and the therapy and all that kind of stuff that we did with George, then you have a really good chance of getting him back to a totally normal, totally usable, he can go out and jump, and they can run, and they can be a normal horse with a normal athletic career and a normal life. But if it's a case that it's just kind of sitting, then you're going to have maybe a hard time getting them back to normal.
So is there a cure for EPM?
They will never not have a positive titer.
Okay.
Because, again, the antibodies say EPM touched you.
Right.
So they will never not be touched by EPM. So they will always have, if that's what you're going to consider your positive test, your diagnostic test, then they will always be positive, which means that there's no cure.
Okay.
So it kind of depends what your definition of cure is.
Right.
Right? They'll always have that positive titer because they will always have antibodies for EPM. But you can cure the neurological deficits.
Okay.
So use your best judgment about, about whether you think that means there's a cure or not.
So, okay. I have a few other questions.
Sure.
So if we're talking about EPM, if my horse, George, is in a field with 4 different horses, and George gets EPM,
Sure.
but none of the other horses do, does that mean that they weren't exposed to the EPM, or can you be exposed to it and then not?
Yeah.
Okay.
That's the really tricky thing about EPM is it could be that they didn't eat the specific blade of grass that had the possum poop on it.
Right.
Or it could be that their immune system was a little bit healthier and they're just not showing signs.
Okay.
So EPM does whatever it wants. It's very confusing, and there's no, if then
Right.
in EPM. A lot of other diseases that we deal with, if this happens, then this happens. We treat with this, then this happens. It's a very linear kind of, we know what's going to happen. We know what to expect. We know what to look for. And EPM is just not that way. It does whatever it wants. Sometimes they completely get back to normal, and sometimes they always have deficits. Sometimes it's really minimal, and the only thing you notice is that they're like a little bit spooky and their lip hangs down. And sometimes you have horses that go from, you put them on a trailer perfectly healthy, and you get them off the trailer, and then 2 days later they can't stand up because that stress of being on a trailer has weakened their immune system so much that now these neurological deficits are showing up.
So with that in mind, is there something that, is there a vaccine? Is there something we can do?
There is nothing you can do.
Okay.
Other than doing your best to control
the environment,
which is really hard, right? So you always want to make sure like you're cleaning water troughs and your pest control. But again, not every possum carries EPM, so it's not like we want to just wipe out the possum population. They eat ticks. They're part of our normal environment. So you're really better off to just try to control exposure to that possum feces. So we want to make sure that you're not feeding barn cats around, because barn cats are going to bring in possums, right? If you have food out for your cats, I guarantee you've got possums as well. You want to clean your water troughs regularly, dump, scrub, hose all around the edges. You want to make sure everything's really clean. Pick up feeders. Don't leave them on the ground. Like if you feed on the ground in little feed pans, pick them up, scrub them regularly, because anything that you leave that is down and going to have grain or feed or anything in it is going to attract wildlife, and that wildlife in this area at least is probably going to include possums.
Right.
So there's no vaccine. You can't prevent it other than trying to prevent that exposure.
So if a horse has a compromised immune system, are they more likely to experience those negative effects?
Yes.
Okay.
Yep.
Then the reverse of that, is there anything we can do to strengthen their immune system?
Probably not. I mean, if you have a healthy kind of hale horse, then best of luck. Right. You know what I mean? Like you want them obviously immunocompromised, things like stress, weaning, pregnancy, and broodmares. A lot of times like they'll be fine and then they get pregnant, and the stress of late term pregnancy and foaling, they'll start to show neurological deficits. So trying to avoid really stressful situations might help. But if you've got an otherwise healthy horse, then it's kind of luck of the draw, really. The best you can do is control the environment and try and decrease exposure, and then make sure that they're living a happy life so that they don't have those really big stressors that would decrease their kind of immune protection, I guess.
So if a horse like George, say he starts to exhibit those neurosigns again, then we just hop back on treatment until the signs go away? Okay.
Yep.
And say I'm going to buy a horse and I find out that horse has experienced neurological issues with EPM.
Sure.
Should that disqualify that horse for me?
Oh, geez. So in general, I will say across the board, like if you're going to pre-purchase a horse and you get this as part of your pre-purchase exam, people always want to talk about passing or failing a pre-purchase. And for me, a pre-purchase is not something that a horse passes or fails. It is a fact-finding mission.
Okay.
So, something that would maybe fail a horse for you would be fine for me because I'm a veterinarian and I'm going to get drugs at cost and I know what to look for and I'm happier to manage it. So I can't tell you yes or no because that's a super personal decision, right? You've had this experience with George and it was bad, and then we treated him and now he's pretty good again. And we haven't had him long enough to know that whether or not he's going to relapse. They say something like 50% of horses will exhibit some kind of relapse in the first 2 years after treatment. So maybe he will, maybe he won't. He might have this episode and be treated and go on and be perfectly happy for the rest of his life. No one will ever know.
Mm-hmm.
But it could also be like my guy who came in, got significant, neurological deficits, was treated, and then is fine until he's stressed out, and then you have to treat him again.
Right.
If I had known when I brought him home that was going to be the case, I still would have done it. Again, I'm a vet. Things are cheaper and a little bit easier for me. You know what I mean? That's okay for me. But for somebody who doesn't have the experience or is going to pay much more for the drugs or is just a little uncomfortable or maybe doesn't understand it as much, it's a lot scarier. Yeah. So I can't tell you yes or no that you should take a horse who's had EPM before, but I can tell you that a lot of horses go on to have perfectly reasonable, perfectly fine lives. Athletic performances, can be a broodmare, can keep on doing exactly what they're doing after a course of treatment, and you'd never know the difference.
So would you encourage including a titer test in your PPE?
No. Because, again, a serum titer just means they've been touched by EPM.
Right.
And if in this area, if you were going to disqualify a horse because of a positive antibody titer to EPM, you might never be able to buy a horse again.
Okay.
So you're better suited if you're concerned about EPM on like a pre-purchase or that sort of thing, to get a thorough history and hope that your seller is going to give you the information, right? And then to do a really thorough neuro exam. And then to just know that it's a risk.
Right.
You're taking on a risk. When you buy a horse in general, you're always taking on a risk. You don't know what their history is. You don't know, you hope that your sellers are really great and really open and tell you all the information, but there's a pretty good chance that they're going to miss something. Maybe something happened 3 owners ago that they don't know about. They can't tell you about the EPM because it didn't happen with them. So, as a general rule, anytime you buy a horse, you're taking on some risk. And I don't think that doing a serum titer is going to help you assess risk any better. And I don't think it is a valuable use of your time or money to do CSF titers if they're not showing other neurological deficits. Now, if they are, then maybe it's worth it. Or, if you're pre-purchasing a horse and they're neurological, you just say, thanks anyway, best of luck. But if it's a horse you really want or you're really checking this out, again, CNS and kind of comparing those two, the cerebrospinal fluid titer plus the serum titer is going to be a little bit better to give you an indication of whether or not they have active disease.
Right.
So it's a risk, and that's got to be a personal choice. I can't answer that one for you.
Okay, so my mom has a few questions too.
Sure.
Let me get these questions up on my computer. And also, I didn't know if there are any misconceptions about EPM. I know, when we were posting about George and the issues he was having, I had people saying like that they'd lost horses to EPM and things like that. I know my mom lost a horse to EPM. She said here in the late 90s, early 2000s, it was basically a death sentence.
Yeah.
And that happened to her. So how has that changed?
I think a lot of it is that it's like everything else, right? You see more of it on social media and with the internet, and you see pictures of horses that have EPM and they're muscle wasted on the back, and you see videos of horses that are experiencing EPM symptoms, and we know what to look for now, and the information is so widely disseminated that it's easy for somebody to say, his lip's a little bit droopy and he's a little bit trippy up front. Have you tested for EPM?
Right.
Like, that has become something that we're thinking about now. It's like when you're thinking about buying a red car, all you see on the road are red cars, right? So
I had EPM vision for a while.
I
was
and
like,
everyone
has
everything
EPM.
is neurologic.
Yep.
So, and that's what happens is, you know, we get all this information and it gets so widely disseminated that you'll notice in social media that EPM goes in surges. And it's because some famous horse on the Olympic team was diagnosed with EPM, and now everybody in the world is looking at this platform at this horse that has EPM, and they're comparing their backyard horse to this horse with EPM, saying like, well, he doesn't pick up his right lead either, so obviously he has EPM. So I think part of it is that we're probably catching it a lot sooner, that because it's not just vets who are being taught to look for EPM and say, I'd like to do a neuro exam while I'm here for whatever else. It's owners that are calling and saying, hey, something's wrong with my horse, I'd like you to do a neuro exam. So right. I think we're catching it a lot earlier. I think there have been some developments in drugs and the treatment protocol, and knowing that vitamin E is supportive of the central nervous system, and having other options rather than just the marquee, which is super expensive. I think probably a lot of horses are being treated that weren't being treated before because it's more financially available,
right,
than it would have been when just marquee was available. So, you know, I think it's probably multifactorial that we're improving our outcomes with EPM. Now, there are still horses that undergo some kind of stressful event, and then 2 days later they cannot stand up and they have to be euthanized. And that does happen. It's, I feel like, less likely than than having a horse that kind of trips a little bit, or maybe is a little bit weak behind, or I had a yearling one time that went from like the most perfect colt ever to spooking at things randomly on the way in and out from turnout, and I was like, something is wrong with you. What is wrong with you? And it finally clicked, like, oh, you probably have EPM. And I did a blood test and a neuro exam, and he did have EPM. So we treated him, and then he went on and is perfectly fine and is a racehorse now. But it's noticing those things, hopefully early enough that you can actually get some treatment into them.
Right, which again is why I'm so grateful for you and Lisa, because I would not have noticed it in George at all. I would have just said, he doesn't have the muscle tone yet, we just have to keep working.
Right.
And that was, so he actually fell with my mom on it. We were on a trail ride, we were walking, and he tripped. So he spooked at something, and we were walking by a bush, and he just did a little spook, but he tripped over his own feet basically, and then just fell on his face. And again, we were like, well, this is our first time on trail, and he doesn't have the muscle tone, and we don't know his experience under saddle, and all of those things. Then bring him to the trainer, and then the trainer, he trips when he's trying to pick up the canter, and you again hit those. Because
so many of these neurological deficits are little, right? It's just, they drop a little grain when they're eating. Well, maybe he needs his teeth done. Well, maybe he's just not paying attention. Well, maybe I should soak his grain. Or they lose a little bit of their top line. Well, maybe he needs some pole work. Or, well, it's really cold outside, we're not really working. Or he's just getting old. Or, they start to trip a little. Well, his toes are really long, and it's been really long since he's gotten his feet done.
Yeah, he had big clown feet.
Right? Yep. So there's so many little things that are indicative of neurological deficits that we can write off so easily. You can think of 5 excuses for every little thing.
Right.
It's not until you notice that he's dropping grain, and his lip is hanging, and he's lost muscle tone, and he's dragging his toes, where you're like, wait a second.
Right.
So if it walks like a duck and it quacks like a duck,
it's EPM.
It's EPM.
I like that.
Right.
Okay, so how do you know if the treatment is working?
So we talked about the die-off. So you'll start the treatment, and a lot of times in that first kind of 10 to 14 days, you'll see them get worse, and it's really scary for owners. But then you should see a pretty precipitous improvement. So you'll see them all of a sudden, where they were tripping, they're picking up their feet, and where they were hanging their lip, they've got that kind of tight, appropriate mouth. Now, I keep talking about hanging lips. There are some horses that's just their face. So this, again, it's really important to look at kind of the whole horse, as opposed to just making sure, like, oh, your lip is drooping, you have EPM.
Right, like with the Andalusian, his lip was never drooping, and then all of a sudden he could not suck it back up.
Right, so we definitely want to know what normal is for these horses before we decide that something is abnormal, and you definitely want to look at a whole horse picture, as opposed to just, like, some horses do just trip. They're just not paying attention to where their feet are. Young horses, rode a thoroughbred one time that like for the first 6 months that I rode him, he just tripped, and then all of a sudden he was like, I'm a grown up, and he learned to use his back and pick up his feet, and he didn't trip anymore. So
it's all of the things in
it's
conjunction.
all of the things, yes.
Yeah. Which again is why it's so hard to diagnose. Hard.
Exactly. So the goal of treatment is to see an improvement in those neurological signs. So they stop tripping, they suck their mouth back up where it's supposed to be, they start to put muscle on, they seem more coordinated, so the neuro exam is not difficult. If you can learn how to do a neuro exam, then you can do it at home. So you can circle your horse and watch where their feet go, and you can pick it up and ask them to back up a couple steps. So if you learn what normal is, and then you learn how to recognize what's abnormal, then you can do your own little neuro exam. I would not recommend it in the first 2 to maybe 4 weeks, depending on how badly affected your horse is. But after that, I'd say first course of treatment, that 28 to 30 days, I would maybe start doing your own little neuro exam. Go slow, because if they're not improved, you can absolutely make them fall over. But there's no reason that owners can't learn a little bit about a neuro exam and start to watch and notice that improvement. And then if you have concerns, it gives you a really good indication of when to call your vet, because you have additional concerns.
Right. So how do you determine, and you don't have to say like this is exactly what you look for, but how do you make the determination of I think they're ready to start work again?
For me personally, I want them to have a normal neuro exam. So because I'm not the one on the horse, I'm not the one that is going to be undergoing bodily injury if they fall over. I would only be the one that they're calling saying, Sarah, he fell and busted his knee or whatever. I'm only going to be on the kind of the receiving end of the bad things that happen. I am really conservative. So I want a horse to have a normal neuro exam before I say you can ride them again. There are some things that we can do between starting treatment and riding that might help them to rebuild some muscle, right? Help them to kind of reconnect neurons that have been disconnected by EPM. So things like slow walking in deep footing, where they have to really think about picking their feet up, and that's another really great way for you to notice if they're dragging feet, because you'll notice the drag marks. As they improve, you can do things like walking over poles, not elevated poles, just right on the ground. Again, you're asking them to pick up their feet and notice how their body is moving, and to really be purposeful about how their body is moving. Things like balance pads, which George loved, right? So you just yesterday or this morning posted a video of him on his balance pad. So I'm a huge fan of those for anything neurologic. I love them anyway. I put all of my horses on balance pads, even the like perfectly healthy sound ones, because I think it gives them a little bit of autonomy over how their body is positioned and how they're moving. I just feel like it's really nice for them, but especially for things that have neurological deficits. So the damage that's done in the nervous system can be wired over. So stick with me.
Okay.
So not repaired, because you're not going to be repairing those particular neurons, but neuroplasticity means that the nervous system is really adjustable and really plastic and really dynamic, which means that as you start doing new things, the nervous system will start to create new neurons.
Okay.
So as you're putting them on these balance pads and they're kind of figuring out where they want their body to be, and they're swaying and they're kind of moving on their own, their nervous system in those tiny little movements is recreating neurons to reconnect their central nervous system to their feet.
Okay. And so this is just kind of a lower stakes way to do that?
Absolutely. Okay. So there's almost no stakes to it. They would be standing anyway. You're just asking them to stand on something. And the nice thing is that all you need is something that's a little bit unstable for them. So if you don't want to spend the money on a balance pad, you can fold up a towel. It has the same effect.
Okay.
Yeah.
I didn't know that.
Yeah, it's really cool. I mean, I've had clients that like order the balance pads while they're on Amazon ordering the balance pads, and they're like, but what can I do in the 3 days before it comes? I'm like, well, you have a bunch of towels, put them in a blanket bag or in a pillowcase and have them stand on that. So it's really accessible, it's really low stakes, it's low pressure. As long as your horse is healthy enough and balanced enough to pick up a foot to be able to put it down on something like that, you can do it.
I think we're going to need to do a tutorial.
Yeah.
Okay, let me see if I have anything else that we need to know. Okay, we already talked about that. Yeah, my mom says that at one point there was a vaccine.
As far as I know, there is not a vaccine. There is not currently a
She
vaccine.
said it wasn't very, essentially her memory of it is that it, not that it wasn't effective, but essentially the titer thing, like you would always show positive, so they couldn't prove whether or not it worked.
Yeah. So there are a couple of vaccines that with which that is a concern, that you have to have a negative titer before you can vaccinate them, because it's a live vaccine that will induce an immune response, which means they will now always test positive for that disease.
Interesting. Okay. So, but we'll get back to that one day. Hopefully they'll come up with something.
Yeah, maybe one day. I don't know.
I don't know. Do you know any other like misconceptions about EPM or questions that people often ask you?
I think a lot of people now, because it's such a thing on social media, a lot of the misconceptions have been addressed.
Yeah.
I think if we were doing this 10 years ago, everybody thought that EPM was a death sentence, period. You would never get on a horse again that had EPM because they were going to fall out from under you and die. So I think, again, because of social media, because we're disseminating information really widely, because there are brilliant veterinarians on TikTok and Instagram and Facebook saying, like, hey, here's a bunch of information about this, recording their neuro exams and showing you exactly what the tests mean and how it should look and showing you normal. I think it's really great that social media is a thing and that we're able to spread information, because you're getting rid of so much of that misinformation.
Right.
Yeah, I think the hardest thing right now that I deal with as a veterinarian is saying, well, I can do the blood test, but it probably won't tell you anything.
Right.
Right? So, because people will say, I want to test them for EPN. And I say, okay.
Right.
As long as you know that it's not going to give us an indication of whether or not this particular issue is because of EPM. We're just going to know that at some point he was exposed to it. So a lot of vets will just say, no, I don't do EPM testing. We're making this diagnosis based on how the horse stands in our neuro exam and exclusion of other things.
Right.
So a lot of vets just won't do it, and that's perfectly fine, because you're getting relatively limited and often not very useful information from it.
And still we must.
So.
Yes, and I believe that we did the Lyme test with George, the exclusionary test.
We did.
Also.
So that was part of it, is we drew for both of those neurological diseases. We were pretty sure that it was EPM because he had the droopy lip and the tripping and the toe dragging. And, more often Lyme presents as like a switching leg lameness. It's a little bit of a different presentation, but because EPM can affect everywhere in the central nervous system, you have to just account for it, because it can just do whatever it wants.
Right.
So we did do testing for both. He came back with a positive titer, which we figured was going to happen regardless, and then no indication of Lyme disease. So we were like, great. He's neuro. He has a positive EPM titer and a negative Lyme test. So, like, this is probably EPM. So let's go ahead and treat him.
Right. And the treatment, to kind of close the loop on George,
yeah.
did work. After about 2 months, we stopped with the pellets. I can't remember. We've been saying them the whole time.
Protozoal.
Yeah.
Or Protozoal.
The Protozoal.
Yeah.
We stopped with the pellets and we stuck to just the vitamins, and then we've been riding before winter. He was riding again and he was doing all of the things. So he's much improved. There's nothing that I've noticed recently. So we'll obviously continue to keep an eye on him. I've heard that heat can also be a trigger for relapse.
Any of that stress, so cold, heat, trailering for a horse that's not good in a trailer, pregnancy, injury, any of those things that could be considered a big stressor can cause them to relapse.
Okay.
Yeah, so we'll keep an eye on it.
Well, that was fun. I'm not great at the closing.
That's okay. So here's what we'll do.
Okay.
You've posted videos of his first neuro test.
Yeah.
Right? So you have videos of that. You have footage of that. So as kind of to close the loop and to show what normal is and how his recovery has gone, why don't we plan to sometime when it's not quite so frigid outside?
It's very cold if you can't. It's so cold.
It's so cold. Why don't we plan to do a repeat neuro exam, and we'll do the same things that we did in the first, and you can show what the difference is, and we'll talk through that. And then if you guys have questions, you can comment here or on either of our social media, and then we can revisit if we need to.
Speaking of our social media,
Ooh.
you can You can find us. I'm at Well Equestrians, Facebook, Instagram, and YouTube.
Perfect. And I'm at Seven Cedars Equine on Facebook, Instagram, and TikTok.
And thank you so much for joining us. We're going to be back. We're going to try and do every 2 weeks.
Sure.
With new topics and more information. And until then, be well, equestrian.
See you next time.